It's Nicole from Metro Integrative, and this morning we are at Dr. Gary Goldman's office.
Hi.
So we thought it would be really interesting to visit with Dr. Goldman because Dr. Goldman is an integrative gynecologist.
I hope that most of you understand what gynecology is, and that's my background. For 30 years, I've been practicing here on the Upper East Side. I trained at New York Presbyterian Cornell a lot of years ago, and I've been practicing very straightforward gynecology, basically all aspects of standard women's health. Functional medicine is often described as root cause medicine. So we don't necessarily seek primarily the diagnosis. We seek primarily the cause of why someone is not feeling well. But while genetics loads the gun, environment pulls the trigger. So you need not necessarily go on to fulfill your destiny. You can alter what's written in the stars. So much of how we alter that is through a very healthy lifestyle. These are things that your grandparents can tell you. Eat vegetables, get enough rest, be sure and exercise. In functional medicine, we take that to a very deep degree because we investigate each person's individual biochemistry, blood work. We look at their entire life story to ascertain what led them down the road to a path of not being well.
That first appointment is a long one where you're really taking an in-depth history.
It is so long that the first visit starts before the first visit. So we begin with more or less about an hour's worth of at-home questionnaires. It's called the Living Matrix.
Wow.
And it goes back to your birth and everything that's happened since, other than that math test in fourth grade, but we'll skip that. The amount of information generated will typically take me about 2 hours to analyze in a very thoughtful approach. So by the time someone is sitting here at the desk, there's been about 3 hours of work that's gone into it ahead of time. So much of what we do feels like an ordinary doctor visit. You go over your medical history. We do a physical exam. There's often blood tests that go along with it. But that's where the similarities to standard medicine begin and end. The depth of the information that we develop allows us to appreciate the subtleties of where things have gone wrong and where we can subtly manipulate them to make them go right.
An integrative doctor would incorporate all that regardless of their specialty.
Correct.
So you're a gynecologist, yet you want to know
The full
everything.
story. Integrative medicine is a nice way of saying that we bring to the table many different tools. So the tools of functional medicine, the tools of standard allopathic medical care, and we integrate them together to form a basis of care individualized to each patient. So while 3 people can come in with the same complaint of polycystic ovary syndrome, the way that I would treat that is so different for each person based on their genetics, their lab work, how they feel, what are their goals.
You're really interested in how they got that condition.
Correct.
Not just, let's
Not
give
just
you a
make a
pill,
name.
let's remove it, right.
The common phrase is that the standard medical doctor is searching for the answer to the question, what? What is the diagnosis?
Right.
And once you make the diagnosis, I have a pill for that ill. The functional medicine doctor is the obnoxious 3-year-old. We're the ones who say why, and why that, and why that.
Yeah.
We go on and on to the depths
That's
of
great.
people's ability to deal with that question. The amazing thing is how much information you can gather and use to develop a care plan that is so helpful. People come out of here saying, no one ever really heard me before. No one ever really listened. No one appreciated the deeper story, these things that I always thought might be significant, that turn out to be. And turning things around is a gift. We don't stop at gynecology.
Okay.
We take care of the full person. So much so that I now have male patients as well, which is
Really?
kind of a kick for me. Yeah, they've got hair on their chests and stuff. It's very different.
Thank you so much for defining this for us.
You're so welcome. Good luck out there.
Bye, guys.